Hello, and welcome to our channel. If this is the first time you are visiting our channel, please consider subscribing. We create and share high-quality and informative medical videos that will help each one of us make healthy choices and decisions in our daily life. We welcome all of you and appreciate your support and encouragement. We are committed to producing more medical videos that will benefit all of us. Thank you. In today's video, we will talk about seizures and epilepsy. We will cover some of the most critical life-saving tips and information you need to know about these two health conditions. Therefore, make sure you watch till the end of this video. So, let's get started. Here are the 10 questions and topics we will be covering in this video. From the answers to these 10 questions, I promise you will surely discover some life-saving facts and tips about seizures and epilepsy that you need to be aware of. So, here are the questions we will be covering. Number 1. What is a seizure? Number 2. What are some signs and symptoms of a seizure? Number 3. What causes a seizure? Number 4. What are the two types of seizures that you need to be aware of? Number 5. What is the difference between seizure and epilepsy? Number 6. What are some shocking facts about epilepsy that you need to be aware of? Number 7. How are seizures diagnosed? Number 8. How are seizures treated? Number 9. How to help a person who is having a seizure? Number 10. What are some recommended diets for people who experience seizures? Let's get started answering the first question. What is a seizure? A seizure is a sudden electrical disturbance in the brain. It is a burst of uncontrolled electrical activity between brain cells. A seizure can lead to involuntary twitching, stiffness in the body, sudden muscle limpness, changes in a person's behaviors, changes in sensations, or states of awareness. The majority of seizures last from 30 seconds to up to 2 minutes. Note, if a seizure lasts more than 5 minutes, it becomes a medical emergency requiring immediate medical intervention. Now that we defined seizure. So, what are some signs and symptoms of a seizure that you need to be aware of? Signs and symptoms of a seizure depend on the type of seizure that the person is having. Here are some general signs and symptoms of a seizure that a person may exhibit while having a seizure. Number 1. Staring. This is when a person having a seizure experiences blank out or stare into space for a few seconds. Number 2. The person may experience jerking movements of the arms and may experience legs and body stiffness. Number 3. The person may experience breathing problems. It may look like the person has stopped breathing. This breathing problem occurs when the chest muscles tighten during a seizure. However, the muscles will relax, and the person starts breathing normal again. Number 4. The person may suddenly fall for no apparent reason, especially when experiencing loss of consciousness. Number 5. The person may experience loss of bowel or bladder control. Number 6. The person may not respond to noise and words for short periods. Number 7. The person may experience confusion or be in a haze, not fully aware or alert. Number 8. The person may experience periods of rapid eye blinking and staring. Now that we went through some signs and symptoms of seizure. So, what causes a seizure? Even though the cause of a seizure is unknown most of the time, seizures can occur as a result of the following health conditions, and these include a stroke, a closed head injury, an imbalance of nerve signaling brain chemicals, an infection, especially meningitis, brain tumor, brain damage from illness or injury. Now that we went through the causes of seizures. So, what are the main two types of seizures? Even though there are many types of seizures, most seizures can be categorized as either focal or generalized. So, let's start with focal, also called partial seizures. Focal seizures occur when seizure activity is limited to a part of one brain hemisphere. There are two types of focal seizures. Number 1. Focal seizures with retained awareness, which are also referred to as simple partial seizures. These types of seizures are originated from within one brain hemisphere. These seizures do not impair awareness or consciousness. Therefore, the person can still communicate and remember the seizure episode after experiencing this type of seizure. Number 2. Focal seizures with a loss of awareness, which are also called complex partial seizures or psychomotor seizures. These seizures do not involve convulsions. However, when a person experiences these types of seizures, their awareness and consciousness are impaired. This is when the person may be unable to respond to questions. Note: the temporal lobe brain region is where focal seizures originate. Also, while experiencing these kinds of seizures, the person may stop and have a blank look or empty stare. The second category of seizures are called generalized seizures. Generalized seizures happen when abnormal electric activity is set off in both hemispheres of the brain. This is when it spreads all over the brain, involving the left and right hemispheres of the brain. Now that we talked about seizures. So, what is the difference between seizure and epilepsy? We already defined seizure. Now we can define epilepsy. So, epilepsy is a common brain disorder characterized by recurrent seizures. If a person is diagnosed with epilepsy, this means that they already had seizure episodes, usually 2 or more. Therefore, they are considered to have an increased risk of future seizures. Epilepsy is associated with increased susceptibility to seizures. The good news is that epilepsy is treatable. What are some shocking facts about epilepsy in the United States that you need to know? Some of these facts are, and this is according to Medical News Today. Number 1. Epilepsy affects about 2.3 million adults and 467,711 children, aged 0 to 17 years. Number 2. About 1 in 26 people will be diagnosed with epilepsy at some point in their lives. Number 3. About 150,000 new cases of epilepsy will be diagnosed in the US each year. How are seizures diagnosed? There are several diagnostic tests doctors use to determine the cause of your seizure and assess how likely it will occur again. Some of these tests and exams may include: Number 1. Neurological exam. This is when your doctor tests your behavior and motor skills and abilities. The doctor also assesses your mental function to conclude if you have brain and nervous system problems. Number 2. Blood tests. Your doctor will check your blood for any signs of infections, hereditary conditions, blood sugar levels, and electrolyte imbalances that could lead to seizures. Number 3. Lumbar puncture. If your doctor suspects an infection as the cause of a seizure, they will order a sample of cerebrospinal fluid for testing. Cerebrospinal fluid is a clear fluid that surrounds the brain and spinal cord. Number 4. Electroencephalogram, EEG. This is when your doctor attaches electrodes to your scalp to detect and record the electrical activity of your brain. The doctor completes this test to detect a pattern that would show whether a seizure is likely to occur again. Number 5. Computerized tomography CT scan. Your doctor will use a CT scan to get cross-sectional images of your brain. This test is excellent in detecting abnormalities in your brain that might cause a seizure. Some abnormalities this test can detect are tumors, bleeding, and cysts. Number 6. Magnetic resonance imaging, MRI. This is when your doctor is looking for any possible lesions or abnormalities in your brain that could cause seizures. Number 7. Positron emission tomography, PET. This procedure involves injecting a small amount of low-dose radioactive material into your vein to help visualize active areas of the brain and detect possible abnormalities. Now that we talked about some diagnostic tests and exams. So, how are seizures treated? Regarding seizure treatment, most doctors don't start seizure treatment until you've had more than one. This is because a seizure can be an isolated incident and may not occur again. Even though seizures are usually treated using anti-seizure medications and other treatment options, your doctor may consider other seizure treatments, and these include: Number 1. Surgery. Surgery is performed to stop seizures from occurring. This is when your surgeon locates and removes the area of the brain where seizures start. This kind of surgery is primarily for people who experience seizures that originate from the same place in their brain at all times. Number 2. Vagus nerve stimulation. This is when your doctor implants a device underneath the skin of your chest. The role of this device is to send signals to your brain to inhibit possible seizures. Number 3. Responsive neurostimulation. This is when your doctor implants a device on the surface of your brain or within brain tissue. This device has the potential to detect seizure activity and deliver electrical stimulation to stop the seizure. Number 4. Deep brain stimulation. This is when your doctor implants electrodes within specific areas of your brain. These electrodes produce electrical impulses to regulate abnormal brain activity. How to help a person who is having a seizure. To help someone who is having a seizure, here are some steps you need to take, and these are in no particular order. Number 1. Stay calm and time the seizure. This is because most seizures last from 30 seconds to 2 minutes. Note, a seizure that lasts longer than 5 minutes is a medical emergency. Number 2. Carefully put the person onto one side with their mouth pointing to the ground. This prevents saliva from blocking their airway and helps the person breathe more easily. Number 3. Loosen tight neckwear and place a soft pillow under their head if you have one. If you have no pillow, place something soft under their head. Number 4. Never put anything into a person's mouth if they are having a seizure. Number 5. Clear away dangerous objects that you may observe around the person who is having a seizure. Number 6. Be with the person until medical personnel arrive. Now that we covered some of the most important information about seizure. So, what kind of diets help with a seizure? Number 1. The ketogenic diet. This is when you integrate high fat and low carbohydrate into your diet while restricting protein. This kind of diet produces ketones in your system due to using fat instead of carbohydrates for energy. Note, the ketogenic diet is very strict. This is because everything must be measured carefully before consumption. Therefore, people on this type of diet must work closely with a dietitian to make sure they are following the diet accurately. Number 2. The modified Atkins diet. Compared to the ketogenic diet, this diet is less restrictive, but it is still effective. The modified Atkins diet also involves consuming high-fat and low-carbohydrate type of food and fluids. What is unique about this diet is that it has no fluid restrictions, calorie restrictions, or protein restrictions, and you also don't have to weigh or measure the foods you eat. Note, make sure you eliminate foods that are high in simple sugars. This is because these sugars have a high glycemic index, which means they are rapidly absorbed into the body. Your body doesn't use these sugars when consumed excessively, instead, it stores them inside. To summarize, having a seizure can lead to many complex health problems if ignored and not treated on time. So, it is crucial to know its signs and symptoms for early interventions and treatments. Also, you should not delay medical interventions and treatments when you have a seizure. Now it is your turn. What are other ways to help a person who is having a seizure? Please share your experience in the comments below. Please don't forget to like and subscribe to our channel. Thank you.